Welcome to another episode of What Did the Patients Say with Doctors Dana and Lauren Brindisi, sisters and owners of Carolina Functional Neurology Center. We are providing you answers to frequently asked questions and bringing you inside information from real conversations we have with patients on a daily basis. Our goal is to spread the truth on health and healing because we believe everyone deserves to know the answers.
Hi, everyone. I'm Dr. Miret from Carolina Functional Neurology Center. Welcome back to our What Did the Patients Say? This is my wonderful patient, Cameron, who is willing to share their experience before they met us, their treatment at CFNC, and what life is like now. So, Cameron, thank you so much for joining me today.
Thanks.
All right. To start off, can you share with us, like, what brought you into the office, like your story, what symptoms you were experiencing, stuff like that?
Absolutely. So I was a cheerleader. I was an all-star cheerleader my whole life, and I also cheered at Elon University. And it all started about 3.5 years ago when I sustained my first concussion at my all-star cheerleading practice. And it was just a normal practice and everything was going well. And then my flyer did a dismount onto me and we fell and my head slammed onto the floor and I couldn't get up. And the weight of my body was so heavy I couldn't move and I couldn't see. I was hearing ringing in my ears and everything. And at that moment, I knew that this was different and I'd never experienced anything like that. And once I could get up and was aware of my surroundings, I kept practicing. I kept going because unfortunately, it was my all-star cheer practice. I didn't have an athletic trainer there to assess me and make sure that I was okay and taken out. And but the next day, I was grateful that I did have my athletic trainer at Elon, Jill, who was an incredible support system throughout my recovery. And still to this day, she's awesome and an incredible athletic trainer. And I truly don't know what I would do without her. But my goal was, to just get back into cheer and get back to school first, but then get back to cheer because cheer was my life and that's what I wanted to do. But it was so hard and everything was so hard. I couldn't listen to music. I was wearing sunglasses 24/7. It was hard to communicate with people, have conversations, just everything was a struggle. And I was putting up blankets on my windows because I couldn't bear the sunlight and everything was hard and I was struggling eating. I was nauseous all the time and it was hard. And going from being an athlete to that was extremely tough. But it took me a few weeks and I eventually got back into cheer. I got back into everything and I was doing well for a couple months. And then all of a sudden I wasn't doing well. And then my symptoms came back. And then once they came back, they never went away. And that was kind of the start to my post-concussion syndrome journey. And after that, I was trying everything to feel normal. And I was going to physical therapy and seeing different providers and just trying anything to function. And while I was still doing school, still cheering. I was cheering through all of this. I was pushing through pain. I was going to practices and coming home and just crying because I was in so much pain. But I loved the sport. I couldn't imagine my life without it. And I was impacted. Concussions don't just affect you physically, they affect you mentally. And cheer was my life. And that helped me mentally. So this was going on for about over a year. And then I got a second concussion in cheer. And then after that, I just completely had to reevaluate things and take a pause in my life and really focus on taking care of myself and just concussions affect your whole body. And my whole body was affected and I was completely spiraling. And it was hard going through this. They're an invisible injury. And so that was very hard. And that's what I was going through. So, yeah.
Okay. And if you don't mind me asking, when you say pain, just so like when someone hears this, like if you're okay to share,
Yeah.
what pain were you experiencing?
I was feeling pain just behind my suboccipitals right here and behind my eyes. It was like a stabbing pain. It was away, and it was horrible.
Yeah. Okay. So you tried some medications, you tried physical therapy before coming in, and how'd you find us?
I found you all. So I was doing vision therapy with Dr. Durham at Briar Creek Vision Care for a few months before I came to see you all. And she told me about you specifically and how you've helped so many patients. And that's all it took. I immediately jumped and booked a consultation with you all. So.
Love it. Okay. And so when we do consults with patients and whatnot, they always ask like, well, what does treatment look like? And I always answer, I'm like, treatment looks different for everyone. Cause even if someone who's had a concussion or multiple concussions, the next person with concussions is going to look really different. But even then when it varies per condition, but what was your experience like? What was your experience overall and kind of things that you did through treatment?
It was life-changing. I right when I walked in, I immediately knew that you all were going to help me get better. And just from the neurological exam, it was so comprehensive, so detailed. Just everything, you testing my gait and seeing how I walked, the video oculography, looking at my gaze stability, the orthostatic retraining, and that was a huge aspect to my recovery. Just everything, the blood work, making sure metabolically I was okay. Just everything up front was unbelievable. And I went home and I was like, yes, this is the place that's absolutely going to help me. And then just treatment wise, I was going once a week for 2 hours, but I wish I could have been there 5 days a week for 24/7 because I loved it. I loved going. It was my happy place. You all were my happy place. And Casey, McKinley, all of you all were phenomenal. And I remember there was one time that I wasn't feeling the best. I think it was early on, and we stopped treatment, and I sat in the lobby, and Casey brought me ice, and I was sitting there, and you came out in between patients, and you sat and made sure I was okay and talked with me. And I left, and you called me and made sure I was okay getting home. And the next day you followed up with me, and just anything I needed ever, you were always there. And whether that was a phone call after your work hours, just anything, you're always there. And I absolutely loved working with you all and having you as a doctor.
Can make me tear up. I love it. Oh my gosh. I wasn't expecting that one. I love that. Okay. Then compared to when you first came in, how are you doing today?
Incredible. I barely have any pain. I really don't have pain anymore. Occasionally, but barely any. I wake up, I am so strong. I'm working out now intensely. I'm going to workout classes that I used to go to before my concussions, and I'm doing them again, and I'm feeling incredible. And I never thought I'd be at this point, but I'm so thrilled and grateful.
Awesome. If you're okay with it, I just kind of want to tell people like when you and I started working together. So is that okay?
That's fine. Yeah.
Yeah. So Cameron and I began working together, I think over a year ago, probably about a year and a half, I think we're at this point.
Yes.
So everyone kind of asks, how long does treatment take? How long to feel better? What does that look like? And I always tell people like, we try to get people into as much of a maintenance phase or a phase where people are doing stuff at home. Sometimes people do need more treatment. Some people don't. It really depends on quite a bit of factors. And I always kind of preface like people still continue to improve even after like the big bulk of treatment. Like that's kind of like our acute care and acute stuff, and people continue to make those improvements. And so I think you're a great case in that, where we did a lot of treatment up front and then we were doing much less treatment afterwards, and then kind of staying with you and staying in touch with you, making sure that you were still progressing. And then even after you were done necessary, like treatment per se, and we've kind of kept up here and there, you're still improving, and which is what we like to try to tell people, but sometimes hearing it is also really good. So that's awesome. The big one everyone asks is like, what percentage? Everyone's like, if you could put a number on it, what percentage will I likely see improvement? And everyone is different. Everyone has a different story. Everyone's health before getting sick, whether that be a concussion, whether that be something else, is very different, like life before, life after, and everything. And so that all affects improvement and healing and kind of the trajectory. But big one we always get from patients. So kind of, if you can quantify it, a percentage, where would you say you were and where are you at now?
I'd probably say now I'm 99, like very high. I don't know where I'd say I was, probably on the low end percentage wise. Absolutely. I've improved significantly. So
awesome. I love it. It was so much fun working with you and watching you tackle all these things and seeing all that progress. So I love seeing it. But thank you so much for chatting with me today and sharing your story. I appreciate it so much. And for everyone listening, if you have questions for us, please leave a comment on this video, or please reach out to our offices, or reach out to us through other avenues of social media. We try our best to answer everything that we can. If not, you can definitely make a consultation with one of our doctors. You can definitely visit our website at carolinafnc.com for more information. But yes, if you want to see more videos like this, or if you have certain topics that you want us to chat about and answer questions, please reach out to us through any of our platforms. We are more than happy to try to address everything. So thank you so much, Cameron, and thank you for everyone listening.
Thank you so much.